Diabetes mellitus is among the most common chronic conditions worldwide. For this video, I'm going to focus on the most common type 2 diabetes. Type 2 diabetes is characterized by an impairment in how the body regulates and uses blood sugar. Insulin is a hormone made in the pancreas. It allows the body to use glucose for energy. In type 2 diabetes, the pancreas does not make enough insulin, or the body's cells do not respond well to insulin. This means the body cannot use glucose properly as energy. It stays in the blood, leading to high blood sugar. Diabetes is associated with micro and macrovascular complications that can lead to problems with the limbs, especially the feet and eyes, and increase the risk of stroke, heart attacks, and kidney failure. Unfortunately, there is no cure for type 2 diabetes, but there are ways to manage the condition. Blood sugar can be monitored with easy-to-use devices. In some cases, medications may be needed to manage blood sugar. However, managing diabetes is not always easy to achieve. Reach out to a healthcare provider, psychologist, a peer support group, or friends and family if diabetes management is becoming overwhelming. Type 2 diabetes was considered an adult-onset condition for some time. However, recently, younger people are being diagnosed. In fact, diabetes prevalence is increasing around the world, growing in developed and developing countries. How can type 2 diabetes be prevented? There is evidence that lifestyle interventions can prevent diabetes and reduce the likelihood of prediabetes progressing to diabetes. To reduce your risk, focus on building a lifestyle that promotes physical and mental health and well-being, exercising, getting enough sleep, managing stress, drinking water, ceasing smoking, cutting down on alcohol, and spending less time sitting. However, many of the factors that lead to diabetes are out of an individual's control. It is important we advocate for policies and initiatives that promote healthy living, from the supermarket to the school and workplace, through agriculture, transport, and healthcare. We need to provide healthy choices throughout our society and across all of our communities. We also need to recognise that the development of diabetes is complex and incorporates many elements. At the individual level, genetic risk, gene-environment interactions, lifestyle and health behaviours, psychosocial factors like depression or early life adversity, and demographic factors all affect diabetes risk. However, the individual exists within a multi-layered system, and there are many factors at the community, societal, and governmental levels that can also affect the options and facilities available to people to prevent and manage diabetes. This is why it is important to remember there is no type of diabetes that is self-induced, and a person with diabetes, whether type 1, type 2, or gestational, is not at fault for their condition. Diabetes stigma is a big problem in diabetes and can considerably affect well-being. It is important we respect people with diabetes and encourage and support them in achieving the best possible outcomes.